Hey everyone, welcome back to the channel. Today we are breaking down a massive topic in general pathology that always shows up in your university exams, necrosis and gangrene. And we are going to go line by line through the ultimate high yield notes using memory hooks, real world examples, so you can never forget these concepts. Grab your notebook, hit that subscribe button, and let's dive right in. Let's start with coagulative necrosis. Its definition is it is a type of necrosis in which the dead tissue architecture is preserved for several days. And why? Because of the two main reasons: the denaturation of the proteins and inactivation of the hydrolytic enzymes. अगर आप एग्जाम्पल लो तो think of an egg. When you boil an egg, the heat denatures the protein. It changes color, becomes firm, but it holds its shape. That's exactly what happened to the tissue here. The cell dies, but its ghost outline remains the intact because the enzyme that would normally digest it's knocked out. That's why its ghost outline remains intact. So that's what about the definition of the coagulative necrosis. So now what causes this? What causes coagulative necrosis? So the most common cause is ischemia. Ischemia, which leads to the infarction, tissue death due to lack of blood supply. Other causes include hypoxia, some toxin, chemicals, severe burns. That's it. Where does it happen? What are the common sites? So remember this golden rule that all solid organs except the brain, and we are talking about the heart, kidney, spleen, liver, lung and skeletal muscle. Looking at the gross organ, which is this, the gross appearance, so the affected area appears firm, pale and dry, and the dead tissue is sharply demarcated from the surrounding normal healthy tissue. This is the normal healthy tissue. The affected area is this, pale, firm and infarct. And in infarcted solid organ, it forms a classic wedge-shaped infarct, base towards the periphery and apex towards the source of the blood supply. Now comes to the microscopic features, that is microscopic appearance. So there are 6 stages you must write in your exams in the microscopic features. That is, cell outline are preserved, the cytoplasm becomes highly eosinophilic, pycnosis, karyoxis and karyolysis. Okay. So the cell outline are preserved for several days. You can see the tombstones of the cell, that is this. Okay. The cytoplasm become highly eosinophilic, meaning it looks bright because of the protein denaturation, that is this. The nuclei show 3 progressive stages of destruction, that is pycnosis. Pycnosis में shrinkage रहता है, karyosis that is fragmentation, and ultimately karyolysis that is dissolution and fading. This is karyoxis and karyolysis. This is the 3 stages of the destruction, cell destruction. So interestingly, there is no inflammatory reaction in the very early stages because the tissue architecture is still intact. Later on, neutrophils and macrophages infiltrate from the periphery to clean up the mess, and finally that necrotic tissue is gradually removed and replaced by granulation tissue, leading to the fibrosis scar formation. Its clinical significance and comparison. Why does this body do this? So it localizes the area of dead tissue, prevent the injury from spreading immediately to adjacent tissues, and provides a scaffold for healing. And if we quickly compare it to a liquefactive necrosis, So coagulative preserve architecture and results in a firm pale mass, and liquefactive completely destroy architecture and turns into the liquid. Okay, so that is what about the coagulative necrosis. Then second part 2 comes liquefactive necrosis. Unlike coagulative, this is where the dead tissue undergoes rapid enzymatic digestion and is converted into the liquid mass. अगर आप इसका एग्जाम्पल लो लिक्विफैक्टिव नेक्रोसिस का, तो इफ़ कोगुलेटिव नेक्रोसिस इज लाइक अ हार्ड बॉइल्ड एग होल्डिंग इज शेप है, तो लिक्विफैक्टिव नेक्रोसिस इज लाइक अ leaving a piece of fruit out until it turn into mushy watery liquid soup. The cell don't just die, they melt. Okay, in liquefactive necrosis, cell don't just die, they melt. What causes this? The classic textbook example is cerebral infarction, that is most common, that is stroke in the brain. It also happens in the pyogenic bacterial infections which result in abscess formation and some fungal infection. So how does this mechanism work? Okay, how does this mechanism work? Ischemia or severe infection leads to cell death. The dead cells release lysosomal enzymes. These enzymes literally digest the dead cells and surrounding matrix until the tissue becomes fluid, soft and viscid material. Let's come into the morphology. Okay, so you can clearly see the normal brain tissue. Okay, but inside the stroke area there is a soft and liquefied zone, and at the edges you have a granulation tissue, this forming a perimeter around the occluded blood vessels. Okay, grossly the area becomes soft, fluctuant and cystic, and if you cut into it, a liquid, creamy or pus like material oozes out surrounded by a wall of the granulation tissue. When we come into the clinical significance, this leads to the formation of the permanent cavities or abscess. In brain infarct, neurological defects due to loss of tissue, abscess may rupture into the adjacent structures causing serious complications. Healing occurs by fibrosis of the wall or replacement by the glial tissue in the brain. Okay, so that's what about the liquefactive necrosis. Its example, it's cerebral infarct, brain abscess, lung abscess, cold abscess in tuberculosis, some fungal infection, example histoplasmosis. Okay, so the summary of the liquefactive necrosis is liquefactive necrosis in the enzymatic liquefaction of dead tissue resulting in a liquid mass, commonly seen in brain infarcts and abscess. Okay, now let's dive into the caseous necrosis. This is a specific type of necrosis where the dead tissue appears soft, amorphous, granular and yellowish white. It looks exactly like a clumped cheese. That is the most important part. Remember it. It looks like resembles like a cheese. Okay. C for caseous necrosis, C for cheese appearance. Okay. So what's the absolute number one cause of the caseous necrosis? That is tuberculosis, TB, caused by Mycobacterium tuberculosis. Other causes include deep fungal infections like histoplasmosis or coccidioidomycosis and occasionally actinomycosis. Gross and microscopic features. So grossly the lesion forms a nodule. When you cut it open, the surface reveals soft, dry, friable, crumbly, granular, yellowish white material surrounded by a ring of granulomatous inflammation. Microscopically, it splits into two zones. Okay, that is Central area amorphous eosinophilic granular material lacking cellular detail. This is the caseous necrotic area. And surrounding this area, granulomatous inflammation consists of the epithelioid cells, Langerhans giant cell. This is the most important part. Remember it, lymphocytes, fibroblast. So the whole lesion may become surrounded by fibrous tissue, leads to calcification in the old lesion. Example, pulmonary tuberculosis, that is caseating granuloma in the lung. So when you come into the visual analysis and the important points of the caseous necrosis, take a look at the excellent caseating granuloma. That is, फिर से मैं ये दिखा रही हूँ, ठीक है. You can see the central piece, pink cheese like necrosis encircled by epithelioid cells, okay, and giant cells, ठीक है, this, and all wrapped up in a fibrous tissue capsule with lymphocytes. So important exam points you have to remember this, that caseous necrosis is actually a hybrid form, that is a modified combination of the coagulative necrosis. That's it. The necrotic material is poorly enzymatically digested, which is why it stays dry and granular instead of liquefying. And in old healed lesions, it frequently undergoes dystrophic calcification. Now come into the fat necrosis. Moving on to a short note, favorite for 5 marks, okay, fat necrosis. It is favorite for 5 marks question, okay, favorite question of university. This is a specialized form of tissue necrosis where adipocytes, fat cells, are destroyed by the enzymatic action of lipases, releasing fatty acids which cause an inflammatory reaction and often undergo calcification. What trigger it? So that is two main parts, that is trauma, enzymatic action. Trauma like a physical injury to the breast or subcutaneous fat, and enzymatic action, that is acute pancreatic lipases. Ischemia is also causes and other, that is saponification in chronic ulcers and post-surgical area. But the two main important points are trauma and enzymatic action. When we come into the pathogenesis, okay, so let's follow the flow chart step by step. So release of lipases due to trauma and pancreatic damage. This lipases digest the triglyceride stored inside the adipocytes, and this splits them open, causing a massive release of the free fatty acids. And this free fatty acids combines with the calcium ions in the tissue. This process is called saponification. And it literally creates calcium soaps. And this triggers a localized inflammatory reaction followed by fibrosis and dystrophic calcification. Okay, this is the pathogenesis of the fat necrosis. If we take an example, so saponification is the exact chemical process used to make commercial bar soap. Your body is literally converting damaged body fat into chalky and hard soap deposits. That's it. Grossly, you will see small, firm, ill-defined yellowish white chalk areas. Okay, the gross features. Clinical pearl in the breast, a traumatic fat necrosis forms a firm irregular mass that can perfectly mimic breast carcinoma both clinically and on a mammogram. So a biopsy is crucial to rule out cancer. And microscopically look at the stages in the diagram, that is this: early enzymatic, ghost adipocyte shadow cells that retain their round outline but have no nuclei. You can see there is no nuclei on this. but because why it has no nuclei? Because the fat inside has been digested, that's why nuclei is not into it. Then second comes our inflammatory stage. Neutrophil, foamy macrophages and foreign body giant cells swarm the area. Then late stages, you see fibrosis around the necrotic fat, this, and dark deposit, basophilic calcium deposit, soap calcium, dystrophic calcification, this. So these are the stages of the when we see the microscopic structure. Okay, so this is a typical microscopic picture, that is ghost adipocyte shadow cells, okay, the neutrophils, inflammatory cells, and the foamy macrophages, foreign body giant cell, fibrous tissues, and the basophilic calcium deposit. This is the most important typical microscopy of fat necrosis. You can draw in your university exam, it is very easy. So this is what about the fat necrosis, and the key point you have to remember it, enzymatic destruction of fat leads to inflammation, then fibrosis, and then calcification. That's it. That is what about the fat necrosis. Now let's shift gears to gangrene. What exactly is gangrene? Gangrene is the death of a part or tissue of the body due to ischemia with superadded putrefaction, bacterial rotting. Think of it like this, that is necrosis plus infection rotting is equal to gangrene. That's it. And what causes it? Arterial obstruction like atherosclerosis or thrombosis, venous obstruction, this, thrombophlebitis, venous occlusion, trauma, infection, and diabetes mellitus, Raynaud disease, shock, prolonged hypotension. These are the etiology. Okay, then comes to the four major types. Dry gangrene caused by arterial insufficiency. The tissue becomes dry, shriveled, mummified, and turns black or dark brown, and it has a well demarcated line separating the dead tissue from healthy tissue, and usually has no infection or discharge. Classic example, that is diabetic foot, which can you see in the image, that is this, due to the atherosclerosis. Then comes our wet gangrene caused by venous obstruction. Because blood can't drain, the tissue becomes swollen, congested, soft, sudden, and dark red or blue. It has poor demarcation, a foul smelling discharge, and infection spread rapidly. Classic example is the strangulated hernia or volvus in the intestine. That is a classic example. You can see in the diagram. Gas gangrene caused by a gas forming clostridial infection entering a severe contaminated wound. It features rapid onset, swelling, and unique symptom called crepitus, which feels like a which feels like a crackling bubble wrap under the skin due to trapped gas bubbles. Okay, and damp gangrene, infected gangrene. This happens when a case of dry gangrene gets a secondary bacterial infection, turning it moist, foul smelling, causing it to a spreading rapidly. Damp gangrene to moist infected, you can see the moist infected tissue and foul smelling discharge. That is a dry gangrene toe type, dry blackish mummified tissue, line of this is the line of the demarcation which we previously read. Wet gangrene intestine, swollen congested tissue, intestine, foul swelling discharge. Gas gangrene, gas bubbles in the leg, crepitus, swelling and discoloration. Okay, journal features, complications, and treatment. So across all types of gangrene, common features include black brown discoloration, loss of sensation, coldness of the part, and a foul smell, that is this, except in pure dry gangrene. If left untreated, it leads to a massive complications like septicemia, toxemia, shock, multi-organ failure, and death. And how do we treat it? So we must treat the underlying cause, improve blood supply, administer high dose antibiotic, provide IV fluids, analgesics, and perform surgical debridement or amputation of the necrotic part to save the patient's life. Okay. So treat underlying cause, improve blood supply, antibiotic if infection present, analgesic and fluids, surgical debridement, amputation of the necrotic part. So that is what about the gangrene. एंड अगर गैंग्रीन का आपको आया यूनिवर्सिटी एग्ज़ाम में तो आप डेफिनेशन, एटियोलॉजी, पैथोजेनेसिस, टाइप्स विद फीचर्स एंड एग्जांपल, कॉम्प्लिकेशन एंड ट्रीटमेंट प्रिंसिपल्स, इतना इफ़ यू कैन you have to write in the exam. Okay, now comes to the dry gangrene versus wet gangrene, the ultimate comparison, and it is also the important for BDS second year university exam and NEET MDS. So line by line, to wrap up your long answer or viva question, let's look at the ultimate showdown, dry versus wet gangrene. So primary cause, dry gangrene, that is gradual occlusion of arteries, ischemia to coagulative necrosis, where wet gangrene is venous obstruction or strangulation, that is congestion plus infection, liquefactive necrosis. Now secondary comes the affected tissues. In dry gangrene, prefers dry tissues, organs, limbs, fingers, toes, ear, nose. And in wet gangrene, prefers moist tissues, organs, intestines, lung, brain, and genitalia. Appearance of dry gangrene: dry, shriveled, mummified, black brown, and wet gangrene swollen, soft, sodden, grayish red or blackish. Consistency of dry gangrene: hard and leathery, and consistency of wet gangrene: soft and friable. Line of demarcation, that is well marked and instinct, and absent or very ill defined line of demarcation in wet gangrene. You can see the line of demarcation well marked. Okay, but in the wet gangrene, no definite line of kahin mark of diffraction. Okay, when it comes to the infection in dry gangrene, usually absent, tissue is too dry for bacteria to grow, but in wet gangrene present with heavy bacterial growth plus putrefaction. Separations, sloughs off slowly via auto amputation at the line, and does not separate, spreads rapidly to adjacent part in wet gangrene. Systematic effects: minimal constitutional disturbance, and in wet gangrene severe constitutional disturbance, that is fever, toxemia, shock. Smell is absent in dry gangrene, but the foul smelling due to the active rotting and putrefaction in wet gangrene. Examples of classic example of dry gangrene, that is atherosclerosis of toes, Raynaud's disease, and frostbite. And in wet gangrene, intestinal gangrene, lung abscess, strangulated hernia. So the key points, remember it, that in the dry gangrene toe, the key points, if you remember, in dry gangrene toe, how shriveled and mummified the tissue is. See how shriveled the mummified the tissue is, with what distinct line separating it from the healthy pink skin. Wherein the wet gangrene of the intestine, it looks bloated. It looks bloated from the healthy pink skin. Okay. and purple black with absolute no clear line of demarcation. To sum it up for your exams, dry means dry, shriveled and well demarcated. Wet means wet, swollen, infected. Gas means gas in tissues with crepitus, and damp means dry gangrene that converted to wet due to secondary infection. That is what about the gangrene, okay, and necrosis. So that is a complete wrap up on necrosis and gangrene. And if you found this line by line breakdown helpful, make sure to give this video a thumbs up, share it with your dental college classmates, and comment down below what pathology topic you want me to cover next. So see you in the next lecture. Thank you.